In 2021, I was diagnosed with pancreatic cancer. I'd felt reasonably well, albeit with some weight loss and atypical non-GI symptoms, and I'd been back and forth to the GP for about 7 months. After the 5th unfruitful visit and a suggestion of more meds, I declined those and asked for a referral letter which I could take to a private specialist. What followed was a consultation and a diagnostics which unearthed my pancreatic tumour, after which referral to an HPB specialist was promptly made. Meeting the surgeon and being presented with the full picture and potential treatment options, heavily caveated with the dire prognosis stats, was hard to hear. On reflection though, I know I was fortunate to have been treated in a major HPB centre at the Manchester Royal Infirmary, and my care there by the whole team, but led by the superb surgeon and his wonderful CNS, was excellent. From the get-go, the surgeon talked with me about staying as well as possible before and during all the treatment, eating well, staying hydrated, gentle exercise, sleep. It really seemed strange advice at the time when my world had just fallen apart and I really thought I was going to die. But I now know he was trying to make sure I got the best outcomes from all my treatments. It was also important because it gave me back some control. They were things that I could do to help myself. Following an uneventful post-op recovery, I was referred for adjuvant chemotherapy to the Christie Hospital in Manchester, another centre of excellence. How fortunate was I? Months of chemo followed, gruelling, but achieved, and I remain well now. Once I was in the system, I had few problems accessing treatment. I researched all the options before they were told to me, and so I knew that the surgery and the chemo I was being offered were gold standard. I'm a tenacious person and I had enough physical and mental strength to advocate for myself. My time now is spent in supporting others who've had a pancreatic cancer diagnosis. My advice to them is to try to educate and advocate for yourself if you feel well enough to do so, or to ask a loved one to do that on your behalf. It really is important. Reaching out to the treating team, general practice or charitable sector, for example, Pancreatic Cancer UK, which is superb, can be really helpful. The implications of this diagnosis are overwhelming, but I urge people to push for explanations if they don't understand, not to be afraid, and to ask for second opinions, particularly from HPB specialists if they believe that would benefit them. Unfortunately, I know from interactions that I've had with people who've had a pancreatic cancer diagnosis that the treatment package I benefited from isn't universally offered throughout the UK. That there's a huge gap in the narrative around pancreatic cancer and an inherent negativity about the disease. Without doubt, this is an aggressive cancer where the outcomes are frequently poor. In fact, they haven't changed in decades, but it is important to offer treatment to those people who may benefit if we're ever going to shift the dial on this. Data from the National Pancreatic Cancer Audit suggests that across the UK, only just over half of those diagnosed with non-metastatic disease receive any form of disease-targeted treatment. While some people in this group may be too frail to tolerate such treatments, statistics confirm that of those with a good performance status at diagnosis, only 2/3 receive disease-targeted treatments. Worryingly, these are average stats, and there's wide variation in treatment rates across NHS provider trusts. A diagnosis of pancreatic cancer is devastating and shocking. Many people, if offered, will accept treatment if they believe it will save or prolong their lives. Unfortunately, the reality is that the opportunity for a positive outcome is not being realised because treatments are not always being offered to those who may benefit. I appeal to healthcare teams, provider trusts and cancer alliances to work with the National Pancreatic Cancer Audit team to fully understand their own performance data and benchmark position in respect of treatment offers, and to engage with best practice initiatives in order that patients are given the best chance of survival. We all deserve it.